Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us once again. In our series dealing with Blooms The Chemist, Australia's leading community pharmacy, we're going to be speaking in this segment with Emmanuel Vavoulas. He's head of retail at Blooms The Chemist. As I said, Australia's leading community pharmacy. He's joining us to talk about a recent white paper that they published detailing their response to the COVID-19 pandemic. This white paper is entitled Lessons Learned from the Frontline of a Health Emergency. This paper includes ensuring the community's access to health and medical supplies, such as home-delivered medicine and maintaining access for those of us who are most vulnerable. Welcome to Health Professional Radio, Emmanuel Vavoulas. Thank you for taking the time.
Thank you.
Talk about your role briefly there at Blooms The Chemist as head of retail.
Yeah, head of retail has a wide scope, quite a wide range where we look at acquiring pharmacies, bringing them into our network, setting them up for success, helping them with anything from their leasing, from signage, shop fitting, all the way down to day-to-day operations. So quite a wide range of roles.
As head of retail, talk about this white paper that Blooms The Chemist published, Lessons Learned from the Frontline of a Health Emergency. Obviously, this is a true health emergency, this COVID-19 pandemic. What are some of the challenges from a pharmaceutical retail standpoint that this pandemic has presented?
The challenges that we faced primarily were the safety of our people. We found being frontline staff, frontline to the pandemic, and one of the essential services that never closed, we found we're always in access to the public. So ensuring that our staff and that our customers were safe and that they felt safe was one of our top priorities. Another one of the challenges that we faced was maintaining stock, maintaining the products within the pharmacy that were in demand and that were required by the community, and ensuring that we didn't run out of any of those. So they were our two biggest challenges, and we felt that we looked after them quite well.
What did you notice was the biggest change due to the pandemic? People stockpiling, rushing to get more meds, or people not coming out to get their meds as much for fear of infection or other transportation issues, things of that nature from a retail standpoint?
Yeah, at Blooms The Chemist, the first thing that we noticed, and I'm sure that everyone noticed, was the fear amongst the community. And when stricter sort of closures were being spoken about, this did drive panic into the community, and people rushed out to stockpile, and it was quite important and something that we communicated straight away to all our professionals is to maintain our standards when supplying medications and when supplying anything within the pharmacy, so that there was enough supply for all the community. We found that speaking to our suppliers on a daily basis and looking for any stock trends or looking for being able to anticipate any shortages was something that we did on a daily basis, and that we just kept front of mind, kept communicating, the lines of communication open between the suppliers to us and from us at Blooms Chemist to our pharmacies, and just ensured they were all kept abreast of any stock shortages that may come up.
What about ensuring that access by the community? This white paper talks in depth about that, medical supplies delivered to the home and getting those supplies to those who may have had access prior to the pandemic, but because of transportation, as we said, now they can't.
This was something that I believe at Blooms The Chemist we were quite agile to adapt and to deliver in quite a strong way. We have always offered free home delivery to our customers, and that way we had the infrastructure to to deliver this immediately. What we found, though, was that due to the unprecedented demand, we were finding that there were pharmacy owners, the pharmacists, even on their way home after a long, stressful day, delivering medicines into the community, all the way into the night. It was some of the elderly and some of the more vulnerable in the community were quite scared to come out, and it was important that we filled that need amongst the community, and that we delivered.
What about equipment that goes from one customer is fixed, cleaned, and goes to another customer? Is that something that has traditionally been pretty prevalent in the home equipment field, and is it something that has changed because of this pandemic?
Yeah, this is something that has changed because of this pandemic, and where something may be used by one customer, it's instead of a hiring scenario, it changed to a purchasing scenario. So where someone may have hired some equipment, brought it back, and it gets used by someone else, obviously cleaned, sterilized in between, as an added level of safety for everyone. We ensured that it would be a new product, unused by anyone else. I think you'd agree that it would add that level of comfort for everyone.
Emmanuel, where do you see the future of medical supply retail going forward? Do you think that we'll embrace this current touchless or telemedicine type of access to healthcare?
I see the future in a hybrid of both. I think there will be people that do crave the one-on-one transaction with the pharmacist, with the pharmacy staff, but I do believe there are people that, like you said, will embrace telehealth and won't look back. This may be a generational thing, but I do believe that telehealth is something that will be embraced by the community.
Well, where can our listeners get some more information about Blooms The Chemist, about this white paper, and delve a bit more into how that white paper talks about ensuring the community's access to health and medical supplies?
They could get access from our website, bloomsthechemist.com.au, right. And they could get all the information they require.
Well, Emmanuel, I appreciate you joining us here on Health Professional Radio this evening.
Thank you. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Emmanuel Vavoulas, head of retail at Blooms The Chemist. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.